This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. It's for women too. Each week, I bring you a special guest to help you create that life that you imagine for yourself and those that you love. We talk anti-aging medicine, personal growth, relationships, and sex, vices, and other topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Also, if you want to know 3 ways to get laid more frequently without begging, go to oldguytalks.com and opt in. When you do, you're going to get my informative video on 3 simple things you can do to get laid more frequently without begging, so you don't have to turn in your man card. And ladies, you may want your man to know these things, because I think you'll like them too. Additionally, you'll be notified weekly when a new podcast episode is ready for you to consume. Periodically, I will share with you other stuff that will help you create that life that you want for yourself and those that are important to you. Don't want to miss anything? Be sure to subscribe, share, and review this podcast. Did you know that there are 76 additives that have been approved by the FDA that can be added to wines? You want a wine with shit in it that may not be good for you? Well, there is an option for wines that have been produced naturally, organically, that have been tested, that have no sugar. And when they don't have any sugar, that means that they're ketosis and intermittent fasting friendly. These wines have been produced with a great deal of care on small farms and are available to you. How do you get them? Find out by going to www.oldguytalks.com/dry farms, all one word with an S, and find out more. And with your initial order, you can get a bottle for 1 penny. That's right, a bottle for 1 penny. And they taste great. They taste great. Don't wait, don't hesitate, don't procrastinate. Get those wines now. This is Orsi, official old guy at oldguytalkstome.com, helping older guys create kick-ass lives for themselves and those that they love. And well, part of that is being able to not wet your pants. let's get right to it. Nothing is more disconcerting than wetting your pants, and you have urinary incontinence. And today we got an expert in the area, Dr. Kelly Sadauckas. She received her doctorate in physical therapy in 2006 and has specialized in pelvic health and orthopedics ever since. She's successfully treated thousands of patients for a variety of pelvic health diagnoses. She has also trained and mentored hundreds of physical and occupational therapists in pelvic health assessments and interventions for both male and female anatomy. She's launching a new online program called Pelvic Floored to reduce geographic, financial, and psychosocial barriers to assessing high-quality pelvic health care. The Pelvic Floored Signature Series is a series of 13 lectures and 9 workouts. These are designed to supplement or to stand in place of an in-person physical assessment for pelvic health conditions. She believes that the current state of men's health with regard to pelvic health is about where women's health was 20 years ago. There's a dearth of information, and she wants to change that. Now, you can find her program at www.thestandard.academy/pelvic. And if you use the promo code ORIS21, you're going to get 15% off the purchase price of any pelvic floored product. That's right. It's a good deal. Yeah.
Woo, yeah.
Yeah. So, all that stuff's going to be in the program notes. If you didn't write that down, or you're in your car, don't be writing down if you're in your car, all that stuff, because it's always in the program notes. So, Dr. Kelly, how you doing today?
Oris? How are you?
I'm doing wonderful. So I always start off with, I have one signature question I start off with, and that is, what is the most important thing you've done today?
Most important thing I've done today? Hugged my children.
Oh, there you go.
Yes.
Oh, you're a good mom.
Oh gosh, yes. I adore being a mom. It's kind of surprised me actually how much I love being a mom.
Really? Okay. That's interesting. Well, actually, my wife said when we got married, she said, I don't want to have any kids. And lo and behold, we got 2 of them.
That happens.
Yeah, she didn't want a suburban eater and a dog, and all that came into play. Actually, we had a Yukon and a suburban at the same time.
Oh man.
Yeah. That was when we were shuttling kids around. So well, that's great. So, Dr. Kelly, let's talk about urinary incontinence, because
let's.
Yeah, because that's what I bet you people love to walk up to you at parties and talk about urinary incontinence.
You have no idea. People learn about what I do and they're like, wait, so it's not normal that I pee my pants, but everybody says it's normal.
Yeah. There's a whole industry of diapers that exists because people think that's normal.
Oh, exactly.
So, you mentioned you were from the Midwest, and so, as being a girl in the Midwest, you don't grow up and say, hey, I want to help men with their wetting, keep men from wetting their pants. So how'd you end up in this space?
Yeah, that's a great question. So while I was going through graduate school, I was involved in some research with females who were amenorrheic, which is a fancy word for they're collegiate athletes and they were exercising too much and not eating enough calories. And so their periods stopped. Which isn't great for female health when that happens when you're 18. So I got involved in the space of pelvic health, helping with athletic performance and working with physicians and nutritionists and dietitians to help these ladies get to the place where their periods could start again. Very exciting and very important for their health at that time. But they got back to performing athletics and they were actually moving better, faster, stronger than ever before, which was wonderful. But these are collegiate athletes and we had a good rapport and they felt comfortable enough coming to me and saying, but Kelly, I'm peeing my pants every time I sprint or every time I spike the ball. And I said, well, I know that there's exercises for incontinence, but I know that just telling you to do Kegels doesn't work. So let me look into that. So I was fortunate enough in my last year of graduate school to go through this 5 or 6 day training in pelvic health evaluation, pelvic muscle evaluation, and take it back to these athletes and assess exactly what their muscles were doing to help them regain continence control. And I primarily focused with female anatomy probably for about 5 to 6 years. And then some studies started coming out talking about the importance of pelvic health care for men, especially around the prostatectomy time, and that they need this pelvic health stuff just as much as females. So I said, well, okay, I'm a therapist to help people, not just to help people with vaginas. So I got into treating men as well. And there's all sorts of additional continuing education. The Herman Wallace Pelvic Rehabilitation Institute's one of the main ones where I was trained, as well as others. And just the more and more word that you get out there about how helpful this is to reducing continence complaints, it changes lives. I still don't know if my parents really understand what I do.
Okay. Well, maybe they're just old-fashioned, don't want to know.
Possible.
Yeah. So let's talk about incontinence in men. And what exactly is what would you define as the definition of incontinence and
sure. Well, I think in its most essence, the definition of incontinence is leaking urine when we don't want to. It can also be leaking stool. That's a little even less talked about than the urine, but the most common problematic one is the leakage of urine when we don't want that to happen. We typically see it in conjunction with constipation and hemorrhoids for a lot of different reasons. Some of the studies will define it as less than 1 pad or any more than 1 pad of leakage per day, you're incontinent. But I think it's any amount of dribble. Like we don't want to be out on the golf course and look down and have a little bit of, wetness on the front of our pants. That's embarrassing. So that's what I would define incontinence as. Okay. And then how physical therapy helps that is continence at its most basic is a pressure balance. And for us to keep pee where we want it to be in the urine, the pressure up has to be greater than the pressure coming down. And that typically needs to come a little bit more from our posture and the muscles of our core. and not 100% from the pelvic floor muscles. And what we see specifically in incontinence with men is it's typically actually caused by a hypertonicity of the pelvic floor muscles, or that the pelvic floor muscles rest too tight all the time. We're never taught about them and about how they should tighten and relax and bear down and relax. And so as a result, over time, these muscles of the bottom of the pelvic floor, they tend to rest up a little bit too tight. And now if that's happening and I'm out playing golf and my muscles are kind of in a fist all the time, they're going to get really tired. If you hold your fist in a, for the 10 minutes we're talking and you try to use it, you can't use it very well, right? So you go and you play golf and you swing, and there's a transient increased downward pressure, and these pelvic floor muscles just give up, and we leak urine, or we laugh, or we cough and we leak urine, or just for no reason whatsoever, you go and you pick up something and you leak urine. So PT can change that by teaching you about how to sense where these pelvic floor muscles are in space, how to relax them a little bit more so they can have better blood flow, and how to improve and control your postural control of your tummy and your butt so that there's not as much downward pressure on your bladder.
Wow, that's kind of interesting. What are the causes? I mean, you kind of described what happens physiologically or physically in incontinence. What are the causes of incontinence? What kind of things cause it in men?
Sure. So besides, just that kind of prolonged hypertonicity of the pelvic floor, that pelvic floor being too tight over time, other things that can cause it, a new back injury or a shoulder injury, anything where we tend to lean more forward or have less than ideal posture, that can cause an exacerbation of it because of the increased downward pressure. Coughing or sneezing a lot. So if it's bad allergy season, that can bring it on. Another thing is just bladder irritability. If we drink a lot of coffee and maybe not so much water, our urine can get dehydrated, and that irritates the bladder and causes it to have more of a downward force. Prostate issues. If you are having some prostate hypertrophy, that can irritate the system and cause those muscles to spasm a bit more, to cause incontinence. Pelvic pain can cause incontinence because that also leads to spasm of the pelvic floor muscles. Those are all kind of probably the most common ones that I see.
Sure. And is there what's kind of the age range that you see basically for incontinence? Does it start? I'm assuming you have some people that kind of outliers that are very young, but what's kind of age range?
Yeah, typically with the male population, the most common time that we start to see it is between 50s and 80s. And like you said, there are outliers where there are some younger. If they are outliers, it's usually also associated with some type of back injury, prostate surgery, or even severe hemorrhoid constipation issue. It's typically around the time of a prostatectomy as well, because of how that changes that muscular balance. Someone who maybe wasn't that in tune with their pelvis to begin with, but was just getting by, now they have this surgical procedure and everything's thrown off. Now they're incontinent post-procedure. So 50 to 80.
Yeah. So let's delve deeper into that. What actually happens when somebody has their prostate removed, or partially or totally, that one of the things that causes incontinence? And we might as well get into the whole subject also, not just incontinence, but of sexual function here.
Oh, absolutely. Because that's more fun. All right. I happen to have an anatomical model here. I don't know if any of us are going to be able to see this, but
the ones on YouTube will, but the ones on Spotify and Stitcher no. So the woman, this is actually first for the old guy. I got a woman holding a well, we won't call it what we could call it, but she's holding a penis, a plastic penis, and and folks, I know everybody that's listening to this, no, it's not a dildo. Okay.
My husband offered to be the model, but I told him it would be inappropriate.
Yeah, there we go. So,
All right.
so now we've got for you listeners, you got also the images in your head.
So I'm going to paint your picture in your head, listeners. All right. So what I'm holding is a cross section of a pelvis with male anatomy. The reason I'm holding this cross section up is because it shows if the base of the pelvis and the pelvic floor muscles are down here at the bottom of the pelvis, the penis comes out the front and the scrotum and testicles are dangling down here. Just above these pelvic floor muscles, there's a little balloon that's like or a little sponge that's your prostate gland. And then there's your bladder up top. Mm-hmm. In this prostate gland kind of circles the tube that goes from your bladder and out the penis. Mm-hmm. In a prostatectomy, depending on levels of all or partial, they'll make an incision in the front of your belly and they'll go in and remove the affected tissues. The neurovasculature that is around this area is remarkable. So the best surgeons will avoid nerves. It's called a nerve sparing procedure, which just means they try their best to identify the nerves and keep them safe and healthy. Even in that case, when they have protected the nerves, a surgical intervention for where they remove this prostate and then sew everything up, that's a trauma to your system. And your system doesn't realize that it was a good thing that your prostate was removed. It's just like, hey, what just happened? And as a result of that stress, your brain tries to protect you and tries to ignore this part of your body, to ignore the pain. It can't successfully ignore all the pain. So what it does successfully ignore is your position sense. It successfully blocks out where those pelvic floor muscles are in space. So if I took your hand, if you held your hand out in front of you, and I twisted your hand up and down and up and down, and I had you close your eyes, hand up, hand down, and I stopped, you would be able to tell me what position your hand is in space. If I ask you right now, Orest, is your pelvic floor relaxed, bared down, or contracted? Would you know?
No.
Yeah. So we need to work on that. But especially post-prostatectomy, it's that proprioception disconnect or that brain-body disconnect that throws off this muscular coordination. So now we don't know if our pelvic floor muscles are tight or relaxed. So over time, the trend is that they actually rest too tight, and that leads to that functional fatigue. And if I'm already so tight and then I get that urge to go and I can't stop it, now I'm even more nervous. And what do? I don't think, well, I should relax those muscles. I think I got to tighten up. So I try to tighten everything up and I kind of make it worse over time. Mm-hmm. So yeah, that's what happens that typically leads to that incontinence. Of course, if the nerve was injured in the procedure, it's a slightly different avenue, or course post-operative, but it's rare that the nerve's actually truly injured. Most usually it's just simply a coordination issue.
Okay. All right. Well, I will tell you, and I've spoken about this before. I had a biopsy and my nerve was injured. Mm-hmm. Yeah.
Have you done pelvic floor PT, Orest?
No, I have not.
Oh my gosh, you want to learn how to do a Kegel? And more importantly than relaxing, you can do it right now. All your listeners can.
But to be real honest, I'm going to pass on that one right now. But actually, urinary incontinence is not an issue for me. So it's just it has not been. I'm sure at some point in my life it probably will become. And actually, I should do some exercise.
Not if you do pelvic floor.
There we go. Okay. She's trying to talk me. She's trying to sweet talk me into the pelvic floor exercise. Okay. So all right. So let's go ahead and do it. What the hell?
Yes, I love it.
Okay. So what's a pelvic floor exercise?
So we're all sitting right now, most likely. Okay. Yeah. And just take a moment and kind of tune in to your bike seat parts. Okay. Mm-hmm. And if you just take a couple relaxed breaths, so belly's relaxed. When you inhale, your belly should get bigger. And you exhale and your belly should get smaller. Can we sense that that's happening in our belly?
Yes.
Great. Now, as you inhale and your belly gets bigger, your pelvic floor parts, your bike seat parts should drop slightly and kind of spread apart, like the balloon is also expanding into your lower pelvis. And then you exhale and they rebound back up. Typically, we have a little better position sense to the rectum rather than the front parts. So take a deep breath in, picture your belly getting bigger, picture your rectum dropping. and exhale. Both of those kind of shorten. This in itself, relaxed breathing is what it's called, is so important for overall pelvic health because it releases the fist of those pelvic floor muscles, and it's going to improve their tissue health, which can lead to reduced pain, improved continence, and improved sexual function. So that's relaxed breathing. Can you feel that?
Yeah, I can. It kind of makes me wonder whether if you do meditation, that actually affects your.
It does.
Yeah, because I've been doing meditation for about 5 years.
Lovely, absolutely lovely.
So I do about 30 minutes of it every day.
It's perfect. So then you, from that position, now that you've tuned into those pelvic floor parts a bit, focus on those bike seat parts. And for men, I want you to very gently tighten the bike seat parts like you're trying to lift the scrotum up out of some really cold water. You guys all know what that feels like. And it's like, and no movement should happen in your butt or your shoulders. And it's just like you're lifting just those parts away from your bike seat. You hold it for about 3 to 5 seconds. And then you relax it back down. And that's the part that's just as important as the lifting. So that's the tightening contraction or the Kegel, and then the relaxation. And then the second part of pelvic floor function, which is vital for long-term continence and sexual function, is the ability to bear down. So now from this resting position, exhale, and just from your bike seat parts, try to push them down and out like it's a flower blossoming, or the anus is opening like you're trying to pass gas. And you hold that for about 5 seconds. And then you relax and it comes back into the middle. That control of the shortening and tightening, relax, and the lengthening, that is pure medicine for your pelvic floor. Ideal circulation, and you're set up for success. If you can do 5-second of those in each direction once a day, it's a great place to start.
Oh, great. Well, that seems fairly simple and straightforward. And you have a much more. It goes on in your program that you have. That you do that. What? Tell us a little bit about the program that you do and what the success rate is and things like that.
Yeah, absolutely. So the Pelvic Floored Signature Series is one of the main ones on my website that is about all types of pelvic pain, incontinence, and back injuries. There will be a prostatectomy prep and post-op specific course that I'm really excited about launching. And essentially that's based upon the evidence that without any type of physical therapy, individuals post-prostatectomy, half of them are going to be continent at 6 months post-prostatectomy.
Okay.
That's dismal. That half of men are still going to be leaking urine 6 months post-prostatectomy.
Sure.
If your musculoskeletal system is not good enough to control urine, there's no way you're going to be having a normal sex life or a normal exercise life for that matter. And those are both things that are very important for overall wellness. So my program includes the pre-op education with the cool model.
There we go. Yeah, there we go.
YouTube get to see. You're welcome. Watch this gets blocked out for us. It gets black flagged.
Oh gosh. Please don't tell me I have enough problems with social media already.
So it goes over the anatomy and what typically will happen. It goes over pre-op exercises, which are more in depth than what we just talked about, but in some degree, just improving your awareness of what your pelvic floor is doing. Just that single preoperative education improves the chance of recovery of continence post-procedure to average return to continence of 3 months. So twice the people being continent in half the time. That's amazing. Okay. Additionally, and while I think that's absolutely incredible, I do think a little more is needed than just that single visit. So my program also includes how you can self-assess your own pelvic floor muscles and figure out, just like you have a right leg and a left leg, you have a right pelvic floor and a left pelvic floor. And sometimes post-prostatectomy, one side will spasm worse than the other, or one side will tighten and the other side will really relax. So kind of how to tune in and identify that. Okay. Additionally, in the prostatectomy course, there's talks about your partner's idea and your partner's health. Some studies have shown that post-prostatectomy, if an individual's partner has interest in resuming sexual function, they're going to get better faster and back to that important part of their life. So is your partner having incontinence or pelvic pain in such a way that she's not demonstrating so much libido? Does she feel that she's pressuring you to get back to this? Or if you are having erectile issues, is she just backing away because she doesn't want to make you feel uncomfortable? So the prostatectomy course has a really great portion about that, about how to have these conversations that are sometimes hard.
Sure.
If this age demographic that we're looking at, is between 50 and 80 years old getting these prostatectomies, those women were raised up in a time where we did not talk about the pelvic floor at all. And it's, for a lot of women, it was a bad thing, a shameful thing to talk about. And they certainly didn't get any pelvic floor rehab after babies or after hysterectomies or bladder surgeries. So they may be dealing with some underlying pelvic conditions. So I really like that there's that part, the couple or the partners education. A common question I get when I talk about that with men, they'll say, well, what am I supposed to do? Tell my wife this young gal on the internet said that you don't want to have sex because your pelvic floor is weak, so you need this too. And I said, no, well, do you have a daughter or a son who's married? Like maybe that's, and I talk to them about it in the phone with your spouse or partner in earshot. Hey, did you know this is a thing now? That just like you get rehab for your knee post-operative, you should get it after having a baby, or it can help leakage. And that can sometimes get the conversation going.
Sure. Because I think, what a lot of guys don't know is that vaginal birth often results in leakage in women very often.
And, totally. Even cesarean. Cesarean has just the same amount of leakage because of that same disconnect.
Oh, okay. Yeah. So that's kind of thing. And so your program is how long typically, and how much time does it take per day to do this?
Absolutely. So the signature series is a little bit more in depth, or a little bit more in breadth, because that's applicable for if you've herniated a disc, if you've had pelvic pain or incontinence for a long time. And that signature series is kind of self-progressed. There are there's 4 different levels of progression, and each one would take about 1 to 2 weeks. Some of us might take a little longer if we really have a big disconnect with our body, but typically it's going to be about an 8-week program. The post-prostatectomy program is about the same length of time, but it's just kind of has different phases. There's a pre-op phase, ideally 4 weeks, but even 1 day pre-op is worth it. And then there's a little period of rest while you have your catheter in, because you don't want to be doing any type of pelvic floor work while that catheter is in. It would be very uncomfortable. Around 10 days post-operatively, when the catheter comes out, that's when you could start the post-prostatectomy program, which is a lot of just gentle breathing at first and body awareness and connection. And it would lead you 8 to 12 weeks of very simple exercises. They honestly take less than a half hour a day. And the most basic ones, the breathing ones, take less than 5 minutes. Sure. But that little investment of connecting brain to body can make a world of difference. And typically once they're done with that, do they have to stay on a maintenance program, or because you said it's a program, and then what happens after you get done with the program? Ideally, if we have reconnected the brain to the body, this is not a forever program. Some people will choose to continue with it just to make sure, or at least just kind of the relaxed breathing and then the Kegel sequence once a day, just because they want to make sure they're in touch with those systems. But if we rehabbed appropriately, your body is now talking to these muscles effectively enough in your daily activities that you don't need to do 30 minutes a day or 30 minutes 3 times a week. And if you find that you are needing that to stay continent or to maintain normal sexual function, then we're actually missing something, because we should be able to get you to a level where you can strengthen these groups, and then after a certain amount of time, go on to your life and not have to do those exercises every day. Okay. And typically, we can handle that if that happens.
Yeah. And so when you say we're missing something, what could be the things that we're missing?
Yeah, typically that means that we probably haven't fully addressed some asymmetry in the pelvic floor muscles. So maybe there's one spot of that fist that's still clenching too much. Maybe as you're doing, the Kegel series, we progress you up to 20-second holds eventually by the end of the program. And we include quick flicks, which is a rapid up and down contraction that we need for things like golf and tennis and basketball. Maybe you're not fully going through all the muscular strength and all the muscle relax. Maybe you're not using that whole range of motion. Maybe you need a little bit more tummy or butt strength. So there's lots of good evidence behind strengthening hip muscles to help support continence and sexual function. So someone who the Kegel train hasn't panned out, I would say go to a pelvic floor in person to check for those asymmetries, but maybe they just need more tummy strength and more butt strength.
Sure.
Maybe every time, if this is your pelvic floor at the bottom, I'm gesturing with a fist at the bottom of the screen, and then this is your tummy muscles in front. What if every time you tighten your tummy, you're also accidentally tightening your pelvic floor? Over time, that's going to lead to that same fatigue. So we have to make sure that when you tighten your tummy, you have the ability to leave the pelvic floor relaxed, and then you only squeeze that pelvic floor when you actually need it. So those are some things that, I do my best in the series to educate, and I think I do a great job. But if you finish the series and you're still having problems, absolutely go into a PT in person. Something fun to talk about is penile clamps.
Okay.
I don't have a picture of one. They're not as scary as they sound. They're like a little oval device that goes right at the base of the penis, and there's medium soft foam that you clamp down. And in the event that you're doing all the right things and you're moving in the right direction, but you're still having some leakage and it's preventing you from going to play golf or going on this hike, you can wear these clamps for up to 2 hours, and they just cramp the urethra. So it gives you that backwards pressure so the pee doesn't come out. Then after you're done with your round of golf, you can go home and take it off. Weisner clamps. I'll send you the way you spell that, Orist, for your program notes.
Okay. All right. Okay. Well, great. And so, this has been very, very interesting. Not something that normally people want to talk about, but it's definitely a problem out there because they are selling a lot of Depends.
They are, Orist. And I mean, when you look at like Google Analytics, like this is something that people are Googling because when they don't want to talk about it, they're looking on the internet. And they need to have good information. And so that's why I'm so excited that you're out there and I'm out there.
Well, I really appreciate that. So in order to get Dr. Kelly's program, go to www.thestandard.academy/pelvic and use the code OREST21 with a capital OREST and get 15% off the price of any pelvic floored product. And this is not something, this is something you can do on your own. You don't have to talk to anyone about it. But I think, a lot of times people really need to talk about as couples about this stuff because it affects both people in the relationships, especially I've done several things on erectile dysfunction, and the pain it causes to both the man and the woman in that relationship, if it's a heterosexual relationship, is pretty significant because there's all sorts of psychological trauma that occurs for the woman. Like, does he love me anymore? Has he found someone else? Has he substituted me with porn? Am I not attractive? Does he love me anymore? And blah, 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 and all those things. Am I not sexy enough for him? Whatever. So people really need to talk about this because there are conversations going on, and they're usually in your head, and they're usually not productive.
Yes, I totally agree, Orest. Yes.
So I think people really need to really deal with this stuff as couples. So, Dr. Kelly, I want to thank you very much. This has been great. It's been wonderful to talk about this subject, and we'll get this word out, and until next time, folks. I'm sorry, go ahead.
One thing I thought of, if you do want to go to pelvic PT and you're like, well, what's the next step? The only insurances that typically require a physician's referral are Medicare and Medicaid services.
Okay.
And it's very easy to get. I mean, you can probably, as long as you've seen your primary provider in the last 3 months, you just say, hey, I want to go to PT for incontinence or for pelvic pain.
Perfect.
Super easy to get. And then a lot of PT clinics are cash-based now. So Google around, find a pelvic floor near me. You do want a pelvic PT that's trained in internal assessment. Even if you don't need it, you want that person to be assessing you that's had all that training because they're going to treat you the best.
Sure. Yeah, and we're certainly getting into the model where a lot of times insurance is no longer a factor for unless you're really, really sick for high quality healthcare.
Exactly. So I just like you guys to know what those steps are.
Okay. All right. Well, Dr. Kelly, thank you. And it's been wonderful. This is Orest Official Old Guy at oldguytalksme.com. Remember, number. All the stuff is there. And I want you to do several things. I want you to subscribe, share, rate, and review. And if you want to give me a bad review, I don't mind that too. I love my trolls. Until next time. Thanks for joining me on this podcast. If you like what you heard and learned, then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it also, and it may be your significant other. And 3, review it. Give me a good review. If you didn't like it, give me a bad review. I don't care. Just review me. And be sure to get my free video on 3 ways to get laid more frequently without begging. Opt in at oldguytalks.com. Don't be that guy that just takes in the information. Take action. Without action, you're not going to get the results you want.